Welcome everyone to this important panel discussion on health rights in the occupied Palestinian territories with a focus on COVID-19 vaccines and access to healthcare. My name is Becca Tybel and I work with Peace Catalyst International here in the Washington, D.C. area. We're focused on grassroots peace building with Christians, Muslims, Jews, and all of our neighbors, and we focus on mobilizing and equipping Christians to love their neighbors well and build peace with everyone in their communities. And I'm also in my dual capacity with the Network of Evangelicals for the Middle East, who works with evangelical pastors and other leaders to focus on a holistic vision of peace in the Middle East and the Holy Land. So we're honored to have our speakers here today with us who are going to be sharing about their work in Israel and Palestine focused on access to healthcare. And first up, we have Dana Moss. Dana is the International Advocacy Coordinator for Physicians for Human Rights in Israel, an organization that was founded during the first Intifada or uprising in 1988, with the belief that healthcare workers have an ethical obligation to speak out and take action for the right to health for all of those living under occupation. And since then, they've expanded their work to advocate for the right to health for all of those under the responsibility of Israel's government. So Dana, we're very honored to have you here with us today, and I'll hand it over to you.
Very much, Becca, for this opportunity. It's nice to meet all of you. I'm going to be speaking about the complexities of the impact of the occupation on health. And I'll start with a case that we recently assisted at Physicians for Human Rights Israel, or PHRI for short. And it was the case of a 7-year-old boy, who I'm going to term T, from Gaza City, who suffers from a rare immune disease. And he underwent a bone marrow transplant in Tel Shomel Hospital in Israel. And that could, in theory, sound as a real success story for joint Israeli-Palestinian work, but the reality is very, very different. You know, when we speak about such cases, it's not that Israel pays for the treatment of such patients. The Palestinian Authority does, until it couldn't pay anymore. What happened is medical monitoring of his condition was stopped because he was no longer able to receive funding from the Palestinian Authority for further follow-up in Israeli hospitals. It's a question of severely limited resources. And when his condition deteriorated to life-threatening, we at PHRI undertook the financial commitment to cover continuous checkups in Tel Shomel Hospital, and his life was saved. Now, Israel loves to claim that under Oslo, healthcare is the responsibility of the Palestinian Authority, and it shirks any responsibility for the Palestinian healthcare system, which has been fragmented and de-developed by various Israeli policies. This is in an everyday context and also with respect to vaccines, as I shall elaborate later. Now, what do I mean by fragmented? Palestinian healthcare system is divided between Gaza, the West Bank, and East Jerusalem. And in order for Palestinians to access one area from another, they have to rely for permits. At the same time, you know, the development is a direct result of the blockade on Gaza, military operations, and the lack of Palestinian Authority control over economic life. For example, the lack of administrative authority for collecting taxes on imports, which impinges on any ability to develop its economy and therefore the Palestinian healthcare system. And you know, that's really the paradigm through which we should think of it. You know, Israel claims that the Palestinian health system is the responsibility of the Palestinian Authority, but in reality, it's kept most of the power, authority, and control and left the responsibility to the Palestinian Authority. And this includes the economic burden. And the impact of this de-development is clear both in our experiences at PHRI and also what we see in the statistics. So as Physicians for Human Rights Israel, where we work on the right to health of all those under the responsibility of the Israeli government, we go to Gaza, or the only Israeli organization to do so, once a month with volunteer physicians. We carry out surgeries, we see patients, and it's also an act of solidarity. What's happening is that we have to bring in our own disposables. because there are not enough disposables in hospitals in Gaza. There are chronic drug shortages that we then try and bring in ourselves. Immunosuppressants, drugs for psychotic disorders, therapeutic milk for babies. You have cases where, we're talking about lack of health resources. And so cancer patients, for example, have to seek treatment outside of Gaza because not all of the cancer protocol is available in the Strip. And if we look and drill down into the statistics of what this de-development as a result of Israeli policies actually means, is we can see the differences between Israel and the occupied Palestinian territory. And so is 12.8 per 1,000 deaths. It's 4 times higher than that of Israel. And if we look at child mortality of those under age 5, it's 2.9 per 1,000 children in the OPT, and 2.9 per 1,000 children in Israel, and 20.9, so 10 times as much in the OPT. And that's why we believe at PHRI that because of the impact of the Israeli occupation on the health system in the OPT, Israel must pay for any treatment the Palestinian Authority cannot. Now, to touch on vaccines, it's one lens through which we can look at the situation. And it's clear here again that Israel shirks its obligation according to international law. Under the Geneva Convention, Israel is supposed to help in the case to help. Israel has no to provide whatever assistance is necessary during times of epidemics and pandemics. Not only does Israel shirk its responsibilities, its response is also characterized by a total lack of transparency. If we look into the numbers, more than 4 million people, including myself, have received 2 vaccines and a booster in Israel. In the OPT, we're talking about less than 50% of the population that needs to be vaccinated has been vaccinated, and only around 10,000 doses of a booster shot have been administered. PHRI, actually together with other human rights organizations, appealed to the Supreme Court in Israel to demand that Israel provide vaccines. There's been a lot of talk about vaccine diplomacy that Israel's done internationally, but when it comes to the OPT, which is its legal responsibility, Israel's response has been very, very minimal. It claimed it would provide Moderna vaccines, 5,000 Moderna vaccines, for Palestinian healthcare staff. From what we understand, it only provided half of those. And throughout the court petition, what we kept hearing is that Israel will not reveal what assistance was actually given. That was a matter of foreign policy, and totally ignoring the lens of occupier and occupied, which is so vital to international law. This is something that has been protested internationally. We ourselves led a call for over 30 human rights and health organizations who called on Israel to provide these vaccines. And we really must look at this as, even in times of global pandemic, Israel refuses to live up to its responsibilities. And all the more so when it comes to a day-to-day context. I think that's pretty much what I want to say. I'm happy to expand on this during the Q&A.
Thank you so much, Dana. That was wonderful. Yeah, definitely feel free to type in the chat any questions you have now. And when we have the Q&A in a little bit, Dana will be able to answer any questions that you may have. So thank you so much. Our next speaker is Sean Carroll. Sean is the president and CEO of Enera, which is an NGO that mobilizes resources for immediate emergency relief and sustainable long-term healthcare, education, and economic development for refugees and other vulnerable communities in Palestine, Lebanon, and Jordan. And his colleague Ahmed Najjar is also here on the ground. So thank you so much, Sean, for being here, and I will hand it over to you.
Thanks, Becca. Thanks very much. Thanks for inviting Enera to this, and thank you all for being here. And Ahmed is our COVID response coordinator in Palestine. He's a pharmacist and works on our medical donations program, so we may have him jump in as well. I'll just build some on what Dana said. I often say, imagine working in a country, imagine living in a country, and this is true in Palestine, and it's true in Lebanon, of course, as well, where Enera works, in Jordan as well, where COVID is the least of your worries, right? It's a global pandemic, which has been our principal worry, arguably for just about every day over the past year and a half. And for Palestinians, it's often not in the top three. And so combating a pandemic when it doesn't even feel like it's the worst of your problems is difficult. Add on to that the occupation, the already strained healthcare system, lack of medicines and medical supplies, and it's a real struggle. So the coronavirus hit a country already struggling. It was understaffed, underfunded, undersupplied in the healthcare sector. High rates of poverty mean that families need to get out and make an income and can't afford to isolate. Initially, there were big shortages on testing kits and on personal protective equipment, PPE. There's a mental health issue, as you all know, and throughout the Palestinian territories, and particularly in Gaza with the trauma of big wars and constant skirmishes. There are real trauma and mental health issues, and the conflict, the COVID sort of creates a lockdown within a lockdown, right, throughout West Bank and Gaza, but particularly Gaza. Food insecurity has gone up. It's estimated that 1.7 million, so just about half or a little more than half of Palestinians suffer from food insecurity. And of course, the pandemic exacerbated that problem, particularly for women. The infection rates and the death rates, you could argue they could have been worse in a country. And again, this is true in Palestine and certainly in Lebanon, and most prominently within refugee camps. It could have been a lot worse if you consider a population that is unable or unwilling to self-distance and mask. It could have been worse. So in some ways, congratulations to the medical staff and the medical system for being able to not have it be worse. And the good news is, I think that infections appear to be slowing down in both the West Bank and Gaza. Vaccines are available in Palestine, as in many countries. It's now more a question of vaccine hesitancy than it is vaccine access. I mean, if suddenly every Palestinian who hasn't been vaccinated went to get vaccinated tomorrow, there wouldn't be enough vaccines. But there are enough right now for those who say they want it, and it's more an issue of overcoming vaccine hesitancy. There have been some pretty clear and strict mandates. West Bank government employees who aren't vaccinated are placed on unpaid leave until the end of the pandemic. Authorities in Gaza have mandated that all government employees be vaccinated, or they'll face repercussions. And of course, Israel has made sure that all Palestinian workers that come into work in Palestine are fully vaccinated before they get their permit request. Dana mentioned, I think it is really important that at the start of the pandemic, there was quite a bit of international debate about whether an occupying force is responsible for a pandemic. And most analysts said that, yes, absolutely. They're not necessarily responsible for all aspects of healthcare, but a global pandemic is one that the occupying force is obligated under international law to take care of. So, you could look at this and say it could have been worse. There are many countries that have far fewer vaccines than the Palestinian territories do. You could say, if you wanted to be positive about Israel, you could say maybe they got some more vaccines because the economies are so tightly connected. But I think we can all agree that the combination of not getting the same level of care and access to vaccines and medicines and medical supplies in the territories as you have in Israel is very clear. You can see it very clearly in the numbers. Early on, it was difficult for the authorities to get vaccines, and Enera has always made it known that if there's any way we can help with actual procurement of vaccines, we could do that. There's some interest from donors of ours and donors of partners of ours in doing that, but our message right now is that we need more support on programs, on campaigns to overcome vaccine hesitancy than we do in purchasing vaccines for COVID. There is a complete shortage of flu vaccines, and as we know, the scientists and public health officials are saying it does make sense to make sure you're getting your COVID vaccine and you're getting your flu vaccine updated. And there are no flu vaccines in Gaza right now. And so we are trying to procure those locally and or get things donated through our medical donations program. Our response on COVID, we've delivered about 2 million pieces of PPE. So the situation would be a lot worse if it weren't for our medical donations partners and our ability to deliver those. We've delivered a host of medicines for treating chronic diseases that make people more vulnerable to the coronavirus and the COVID disease. We recently delivered enough of the antibiotic azithromycin to treat 80,000 patients. This is a medicine that's been identified as a COVID treatment in Palestine, and we've supplied at least 3 months worth of that. We've delivered citalopram for treating mental health conditions, and we are working on increasing our campaign around encouraging vaccines and overcoming vaccine hesitancy. So lots to do. Ahmed, I don't know if you want to add anything. It's the numbers on vaccines. If you take the global statistics, which counts the entire population, Palestine's still in the 20s. 20%, nearing 30%. If you look at those eligible, it gets up closer to 50% because, of course, a huge portion of the population is 16 and under. So still more work to do. Really important. The last thing I'll say is to remember that the pandemic is just one more added challenge on top of several challenges, which are a consistent challenge and strain on the healthcare system. Thanks a lot. Ahmed, did I miss anything? Anything you'd like to add?
No, you actually you are illustrated the situation, the real situation in Palestine, Gaza and West Bank. Yeah.
Thanks.
Thank you, Sean. It's really enlightening to hear some of the different dynamics on the ground and the work that Enera is doing. And yeah, I definitely am learning a lot from this conversation. So thank you both so much for sharing. I do want to give our audience a chance to ask any questions they may have. But I did want to ask one question first, which is just to kick us off. For you all, Sean, and then Dana, for you as well. For us as audience members, as Americans, or wherever we may be calling from, is there something that we can do to kind of come alongside or partner with the work that both of you are doing?
Well, thanks a lot. I keep advocating, keep letting people know what the issues are. Our partners, particularly our medical donation partners, have very much understood that the COVID pandemic puts a strain on the healthcare system. And so we've upped our donations across the board. 2 years ago, we delivered about $37 million worth of medicines and medical supplies in Gaza, in Palestine and Lebanon. And it nearly tripled to 98 million last year. So our partners have been just fantastic. AmeriCares, Direct Relief, International Health Partners in the UK, International Health Partners in Canada, just fantastic. And then recognize that there is still a lot of misinformation out there about the vaccine, and that breeds hesitancy. And we have to lead by example. I mean, I decided that it was going to be mandatory for all Enera staff to get vaccinated, and that brought us up to 100%. We had a lot of hesitancy in Lebanon. We actually were doing a little better in Palestine. We had one person who was a real holdout. She was hesitant, but I think actually mandating it made it easier for her because it didn't give her a choice anymore, and now she's glad she's vaccinated. So I think we have to lead by example. We have to recognize that there's misinformation out there in the Palestinian territories. It gets tied in with the occupation and fears of what what Israel might do to Palestinians with the vaccine. A lot of it is not necessarily sensical, but you can see where it's coming from. So that's something we can do. Recognize that the needs across the board have increased, and we need to be responsive to them. And then specifically on COVID, lead by example. Recognize there need to be structured campaigns, information campaigns with good information that counter the bad information and misinformation.
Thank you, Sean. That's great. Dana, anything to add in terms of how we can support? Mm-hmm.
Right. Listen, I think there are various steps that can be taken. I will say that our position now is that, and this relates to vaccines, but not only, is that Israel, when the medical treatment either doesn't exist or exists at insufficient standards within the occupied Palestinian territory, when this treatment cannot be accessed by Palestinians, Israel has to bear responsibility for that. And that includes the cost of referring patients who require these treatments to hospitals outside of the Palestinian healthcare system. So one thing is to sort of reiterate this call for Israel's responsibility, which is based on the understanding that the occupation has resulted in the development of the Palestinian healthcare system and inability of the Palestinian Authority to invest the necessary health resources. So this is something that you can echo to your representatives and help spread. And I think the other thing is, we're talking about the Palestinian health system. And I'm assuming you all saw the recent designation of 6 Palestinian human rights organizations as terrorist organizations by the Israeli government. And this is very relevant to anyone who cares about health. These organizations work to protect the political and social rights of Palestinians, and that impact their physical and psychological well-being, and allow Palestinians to protest the occupation. And I think this is something where it's kind of a red line that's been crossed, especially because it's based on evidence that even has been noted by leading European states as evidence that Israel has previously provided that's been unsubstantiated. And so I think here there needs to be, again, a call to reiterate that these organizations, prestigious leading human rights organizations, must be protected. I think that's the other sort of part of the puzzle here. I think this is something that all organizations should have an official stance on if they care about the health of Palestinians.
Thank you, Dana. That is such a great point. And for anybody who's not aware of that designation, we'll share more info in the chat, and then we'll also send a follow-up email for anybody who's interested in advocating in favor of not designating these human rights organizations as terrorists. So thank you, Dana, for bringing up that very important point. And I see we have a question from Barbara in the chat. She says, given the world's attention on COVID over the past year and a half, have your organizations identified other gaps in the health sector that are possibly being overlooked as a result?
I'm happy to take that on. So it's a good question. Look, and I agree with Sean's assessment that, COVID is kind of like low down on the list of priorities. Even before, COVID-19, when we at PHRI would speak about the Palestinian healthcare system, specifically also in Gaza, but not only, we say that the healthcare system has an enormous burden as a result of the blockade and military operations, repeated Israeli military operations. And so there's a need across the board, whether it's for critical drugs that are 50% stock, or whether it's for mental health assistance. And the other aspect is, of course, one that I sort of mentioned when I spoke about fragmentation, which is that of medical exit permits. Now, because there are many treatments, including various types of cancer care, that are unavailable in Gaza. Palestinians who, oncology patients, whoever else, need to exit Gaza Strip to access medical care, usually in East Jerusalem, where the most advanced specialist hospitals, Palestinian hospitals, can be found. The problem there is that Israel only allows them to access if they receive a medical exit permit. And according to WHO figures, Israel only permits around 60% of those needing treatment to exit the Gaza Strip in a timely manner. And we're talking about oncology patients here. And over the past year and since January 2020, I believe we've assisted over 200 oncology patients whose request for a medical exit permit has been either denied or left unanswered, which really affects their prognosis. So this is another aspect that's sort of been overlooked by the focus of COVID-19, which is the usual restrictions that Israel places, whether it's in denying access to treatment by physically preventing someone from leaving the Gaza Strip to access a Palestinian hospital in East Jerusalem, or whether it's as a result of missing medications, missing equipment, staff shortages, etc., that result from the development of the Palestinian healthcare system, which again is greatly impacted by the occupation with its elements of colonialism and apartheid.
Thank you, Dana. Sean, did you want to speak to that question at all? Okay.
Thanks.
Yeah, okay. So, yeah, did anybody else have any questions for the panelists? You can feel free to unmute yourself if you do. I guess. Oh, go ahead.
Earlier, we talked about the 7-year-old boy. I think he was in Gaza. And I'm just trying to get this straight. Palestinian Authority is in charge of all the medical support for both Gaza and over in the West Bank. Is that true?
I'm sorry, could you repeat the question? I was answering someone.
Ahmed, you might want to join in as well. The question is on who is the authority for health in Gaza Strip versus West Bank?
Yes.
Yes. Actually, about Palestinian Authority is in charge, for the West Bank and Gaza to deliver all of the medical supplies which needed. But nowadays and for 14 years, there is a political division between the two sides, West Bank and Gaza, and even the Palestinian Authority are suffering from the lack of funding. So it's not the Palestinian Authority is not able to send the medication, especially the cancer medication and chemotherapy, to the Amwach in Gaza.
Okay, so all right. So the Palestinian Authority supports Gaza some of the time or all of the time, or does Gaza have their own capability?
The Palestinian Authority supporting Gaza to some extent, not cover all the needs for the Gazan people.
Okay.
And I want to reiterate,
as you may know, that in Gaza, people in Gaza are live in a big prison for 14 years. There is a strong siege imposed on the people in Gaza. There is a movement restrictions. Even if the Palestinian Authority support Gaza with some kinds of medication, not all medications are available here in Gaza. Not all medication are, allowed to be passed into Gaza. Gaza is developed health facilities. Many patients need to be referred to outside Gaza, maybe to East Jerusalem and maybe to Israel for complicated surgeries. And as Dana mentioned, that 40% of those patients, those patients need to have a permit request to cross areas crossing point to travel to the East Jerusalem. 40% of the permit requests were denied. I know one of my friends, he's died while he's waiting for his permit, you know, just to travel to outside Gaza.
Okay, I understand.
Yeah.
To reinforce what Ahmed is saying, the PA after Oslo, Israel placed the economic burden for the health services in the OPT on the Palestinian Authority. But of course, at the same time that it's placed this burden, it has, as I mentioned, held all power, held all authority, held all control, from freedom of movement of medications to freedom of movement of patients and healthcare staff. And so it's a burden without it's a burden that the PA cannot really live up to. And that's not only in Gaza, of course, though Gaza is the most extreme situation, also the same case for the West Bank.
Can anyone speak to, I think some people maybe don't understand, why do permits not get accepted, or how does that work?
So there's there's a lengthy permit process whereby you first have you first have to pass a local committee which says that your treatment is not available in, say, the Gaza Strip. Then you have to secure financial coverage. So the PA has to say that we provide financial coverage for this treatment. And then Israel requires patients to receive something called a medical exit permit. Israel does not necessarily respond to the request. Sometimes it responds security reasons. That's infrequent. Usually, says refused, or it doesn't even answer. And usually these responses come on the night before the medical appointment. And obviously this impacts patients' well-being. We at PHRI have started to request long-term permits, which are theoretically available, but in reality, not on the ground, for cancer patients. Because what happens is, you go for 1, 2, 3, 4, 5 chemotherapy treatments from Gaza to East Jerusalem, and then on the 6th one, you're refused. You don't know why. You're missing 2 months of treatment. Every time you're refused, you have to reapply, and you have to secure a hospital appointment before you can even receive a permit. And so that delays and delays and delays your treatment. And I have to say, from the 10 requests that we've made for long-term permits, we're talking about 3-month permits so that patients won't have to apply each time again and again. When we're talking about frequent treatments like chemotherapy, we have only had success with 50% of our requests. So that sort of gives a lens as to the arbitrary reasons for refusal. I also have to say, because we work on 200 to 300 cases of permit refusal, whether it's lack of answering or outright denial per year, and our success rate is over 60%. So we appeal to the army, we go to the media, we flag up cases with other local organizations on our social media. Sometimes the minute we get an article in the media, suddenly someone gets their permits. Sometimes the minute we go to the court, day before the person gets their permit. So we can see that if all it takes is for us to publish a story in the media for the decision to be reversed, what sort of security claim is that? What sort of arbitrary reasoning could there be? And I'm very sorry to hear about your friend Ahmed. It's I think that's the inevitable outcome of Israel's freedom of movement restrictions and strangling occupation and blockade. I'm sorry to hear that.
Yeah. Yes, actually, I think that this way, the Israeli side using to treat the Palestinian, especially in Gaza, you know, it's a way to increase the pressure on the people here in Gaza. In addition, you know, to make people, to bring people to the, you know, to the brink. Yes. So, you know, Enera just before 9 months bring a valuable medication, which is a chemotherapy, which named Valcade. It's bortezomib. This medication, you know, the people, the cancer patients are used to travel to East Jerusalem just to have their medication and back again to their homes. So this will add, you know, extra burden on the patients, cancer patients. The cancer patients are must to pay more than $100 for the transportation, and this is just to have the medication and go back to their homes. Enera are successfully bring this Valcade to Gaza, and you know, really make great relief on those patients to have their medication here in Gaza. And this was a big success. So we have many patients here are crying because of the lack of medication. And just the patient said that we are a human being. We should have the right for free movement, to have only the treatment. We are not a terrorist. High percentage of the permits, which is denied for security reasons, was for children. So the Israeli side mean by security reason, so that they are mean by this security reason that please, no question about this permits. We need no question about this permit. Just we denied this permit for security reasons, and stop. So what the fault that children, you know, make for the Israeli side? So this is the life in Gaza. So I'm working with Enera, you know, in the field. So day by day, I saw the patients and meet the cases on the ground. So when one of the mothers meet you crying that one of her babies is diseased with an autoimmune disease, and he want Enera, which is an immunosuppressant, he must take 2 shots in a month. And even the Amouach in Gaza don't have even one single shot from this medication. And the immune system attack one of this child eyes, and he lost the vision in his eye. And the doctor said that to save his other eye, we should bring this medicine. Fortunately, Enera bring about 2,000 vials from this medication, and the doctor impressed how come the vision is restored gradually in the affected eye. What's the problem here? That we are in need to support this child with this medication for 2 years in continuous basis, which is, you know, impossible. The Amouach in Gaza said that it's, you know, in the best condition, we support the patient with only 6 months supply. This is in the rarely cases they are able to support the patients with only 6 months supply of this medication, because it's the cost in Gaza for the single vial is $500. So the doctor, you know, shift the patients with less potent medication. on the other hand, if we are talking about the patients with the chronic medication like diabetic patients and the patients with hypertension, those medication, you know, when COVID invaded Gaza, most of the efforts are, you know, concentrated on the COVID patients and support of the medication, which is valuable for COVID patients. And, you know, people with the chronic medication, you know, are suffering also, even Enera clinics. So the people with the chronic medications are, you know, suffering and asking health facilities, NGOs, to bring their medications, which is chronically needed. And they can, you know, they are not affordable to buy those medications from private pharmacies. So all of life in Gaza was badly affected. If we are talking about the economic situation, which affected people, make those people unable to buy their own medication to treat their children themselves. They are prefer, if they have money, to buy food for their children instead of treating themselves. So hope this situation will be solved soon and people know the tragedy we are living in Gaza. Every 2 years we have an escalation, hundreds of houses completely destroyed, people lived in shelters. You know, even within the last escalation, we have thousands of people escaped asking for protection in the Enera shelters. Those shelters become as focal points for the COVID infection, you know, it's a spreading, you know, points for COVID. So what can we say else? It's our situation here. Thank you so much.
Thank you, Ahmed, for sharing that. Sean, were you going to jump in?
Oh, it's just, you know, it's hard to estimate. And we, you know, on the outside, we always like to talk about how resilient people are, you know, how resilient the Palestinians in Gaza are, or the Lebanese and in Lebanon. And I think that takes a toll. It's a mental health issue as well, right? People are tired of being resilient. And if you think about our response, just one of the programs we're most proud of is we had an integrated school feeding program, because we realize, you know, Enera has an early childhood development program where we're building or renovating kindergartens to provide kindergartens to communities that otherwise wouldn't have them. The authority has declared that preschool kindergarten should be universal education, but they don't have all of the resources to provide it. So Enera and other groups being able to build schools and provide curriculum and do teacher training. But I realized in a visit to Gaza City long before COVID that we had renovated a beautiful school. The kids looked happy. The teachers looked thrilled with their new school and the curriculum and the toys and the furniture. But the kids did look a little hungry. This was from a poorer part of Gaza City, and they looked a little malnourished. And in the back of the school, there was a canteen, a kitchen that Enera had also, under a different program, equipped. We had bought kitchen equipment and we had helped train women to cook, and they were using it to cater. And they were making this, you know, fantastic meal that smelled great, looked great. And I said, "Who's that for?" And they said, "It's for the olive harvest pickers. The foreman contracted us to provide." I said, "Oh, that's fantastic." And I asked, "Do you ever provide it to the children? Do you ever give a hot meal to the children? Because you're right here in the school, right?" And they look a little hungry. And they said, "Well, if we have a little left over, we sell it to the kids who have some pocket change." And I thought, you know, that's not really enough. We need to do more. And so we concocted a integrated school feeding program where the women that we worked with to equip and train to do catering, work with some of the farmers that we provided training and the initial capital to do smallholder farm plots or greenhouses, and these schools to start doing school feeding. And we had just started a program, and as people know, providing a hot meal sometimes makes the difference between a family deciding, oh, I can't afford that $10 a month to send my kid to kindergarten, or I can because they get a hot meal as well, which is nice. So we saw an increase in enrollment, and then COVID hit, and of course schools closed. And so we pivoted and we started providing hot meals to families that were isolated and quarantined. And again, we're feeling great. You know, we're meeting a need. Isn't this fantastic? We can pivot. We're resilient. The Gazans are resilient. And then the May bombing hits, and suddenly we're delivering thousands of meals on an emergency basis to people who've been displaced from their homes because of the bombing. And again, we're feeling great. Wow, we met this new need and we pivoted, but it's tiring for us. Imagine what it's like for people living under those constantly churning and one on top of another crisis. So it's hard to talk about COVID on its own or the health system on its own without talking about all the interrelated challenges. And I think that's kind of a clear message that we've heard today.
Thank you, Sean. Absolutely. And thank you all for everything that you've shared, and the stories that we've heard, I think really illustrates those challenges and the effects of occupation and blockade, which is really the larger structural change that I think we all agree would need to happen. Anna asked in the chat, what can people do to support your work and call for change that will make a difference in the lives of people there? That's for everybody, whoever wants to answer.
Well, I'll jump in. Learn about what we're doing. If there's something in particular you'd like to support, we always welcome that support. Obviously, financial support for what we're doing is very welcome, but also, you've taken the interest and the time to join this conversation today, and I suspect I know some of you and others that I don't know. I'm sure that you give more of your time to be educated and learn what's going on. So being able to echo what you've heard and let other people know, there still is a void of information about what's going on. There is distortion of information, and certainly in the United States, we have a lot of work to do to let people know what's going on. And also, there are bright spots. There are things that we build on. We don't do anything without people like Ahmed and the community that he's from and lives in taking the lead. We're responding to what they tell us are not just the problems, but the solutions. And we can point to a lot of impact that I believe we're having in actually improving lives. And so getting to know our programs and supporting them if you can is always very, very welcome.
Yes, I want to echo what Sean said. And I think, here it's also the important aspect of speaking out. We're talking about the need for structural change, the change of discourse, particularly, but not only in the US. I posted a link to our Facebook page if you want to be updated about our work and what we do. And thank you all for joining and hearing about it, and for your commitment.
Yes, thank you all so much. Ahmed, did you want to add anything?
Thank you so much. Thank you so much.
Thank you. Thank you, everyone.
Thank you.
Enjoy the rest of your day.
Thanks all. Thanks very much.
Thank you. Take care.
Take care.
Bye.
Bye.
So much, Joel.
Bye.